Hi, my name is Zavier. I'm an intern at Leadership Initiatives. I will be helping diagnose and treat you today. So, firstly, can I start by asking you a couple of questions about your symptoms?
Yanzu iya tambayan ki abubuwa ɗaya biyu akan ciwon ki. Yeah,
Mm,
she said you can go ahead.
Okay. What brings you in today to the hospital?
Wai me yake damun ki? Na sati na ko kwana biyu? Okay, she said she's been having this fever for the past 1 week with associated abdominal pain.
Okay. So abdominal pain. So on a scale of 1 to 10, what would you rate your pain in your stomach?
So idan maki goma za a ba wa ciwon ciki na, naki maki nawa za ki ba shi? Hmm? Sai kai bakwai? Ai goma ne mafi yawa. Daga, eh? Okay, she said she can give it a 10.
Okay. Ooh, that's pretty high. Um,
Yeah.
Are you, have you experienced any forms of diarrhea or vomiting?
Akwai gudawa ko amai? Hmm? Okay, she has a few episodes of diarrhea, but there's no vomiting.
For the diarrhea, is it like every single day or is it like every other day?
Uh, Kullum ne kike gudawan ko kuma kina tsallake kwana ɗaya kafin ki sauki? So it's every other day.
Okay. So now I'm gonna ask you about the region which you live in. For your home, do you live near like still water?
Wai a gida kamar a gidanku akwai irin ruwa wanda baya gudana ɗin nan? Eh? Eh, okay. Yes, they have actually a well
Mhm.
in their house. Yeah.
Okay, for the well, when you use the water, do you make sure to boil it? And when you eat, do you wash your food and cook it throughout?
Okay. Wai ruwan nan in misali kuna shan ruwan rijiyar ne? Kuna shan ruwan rijiya? Ba kwa sha. Amma ruwan famfon kuna tafasawa, kuma kuna wanke abincinku sosai kafin ku dafa ko kuma wani abu. Mm. Okay, she said actually the source of drinking water is from a community borehole, and they don't boil the water before drinking the water, but they wash their foods properly before cooking them.
Okay, so mm, I'm suspecting that you have typhoid, and so I would like to run a couple of tests. So for typhoid, what would the results be for the
So we actually ran some tests for her, and we did a wider test that showed significant titers for typhoid fever, which is positive, and it also showed two pluses of malaria parasites on the test.
so typhoid and malaria?
Yeah,
Okay. Um, for the malaria, are you experiencing any tiredness or like aching in the body, like muscle aches?
kina ji kaman akwai ciwon jiki ne ko yes, she actually has muscle aches.
Okay. Um, so the results for the blood test and I mean the rapid diagnostic test, it came back positive for malaria.
Yeah, it's positive.
Okay. So for the treatment for malaria, um, I would treat with anti-malarial. And also, she said she had a fever, so I would prescribe her some antipyretics.
Great, great. So what about typhoid fever?
The typhoid fever, I would also recommend that you,
Would you would you like to prescribe some antibiotics for her?
yes. Oh, and for the malaria, it doesn't seem like it's a complicated case, so I would also recommend some ACT.
Great, great. So, um, is there any other thing you'd like to give your patient?
Well, I would also so that it doesn't happen, I would like to talk about some preventions.
Wonderful. So go ahead, please.
For prevention for malaria, um, I would recommend like if you could afford it, maybe buying from your local store some bug spray or applying a mosquito net so that to eliminate the source that the mosquito lives in. And
Great.
also a more expensive option though is that there's um there's pills that you can take for anti-malaria, often used by travelers.
Great. So wai yana so ya baki shawara ki kare kanki daga malaria, wanda ki amfani da maganin sauro, da ki amfani da mosquito nets, sannan sannan kuma da ƙwayoyi na kare kanki daga malaria. Oh, yeah. So she appreciates everything you said to her. Is there any other preventive measure you want to talk about, especially for typhoid fever?
Yes, going on to typhoid fever, I would recommend that you use a clean source of water. It's okay that to use the community fountain or the community well, but by boiling your water and making sure to wash your food, it will eliminate the bacteria that's in it and also reduce the risk of you getting typhoid fever again.
Great. Wai saboda typhoid kuma ake iya tafasa ruwan da kuke sha. Oh, yawa, so that ku kare kanku daga typhoid. So, yeah. So she appreciates everything that you said to her.
Mhm.
Uh, is there anything you'd like to add to your patient?
Um, I think that's about it. And
Right,
I
then.
appreciate her very much as well.
Right then. She also appreciates you,
Mhm.
and we're also proud of you. Your performance was very wonderful. So
Thank
if there's nothing else you like to say, you can wave your patient goodbye and then we call it a day. Yana daga
Okay.
miki hannu, za ki iya mishi bye bye.
Thank you. Have a good day.
All right, you too, and take care.